Now to discuss this, we are joined by Dr. Yinka Falola, Acting Director, Policy, Planning and Coordination, National Agency for Control of AIDS. Good evening, Doctor, and thank you so much for joining us on News Central TV.
Good evening.
All right, now, Doctor, okay, thank you so much. All right, so Doctor, social media influencers are urging the public to end discrimination against HIV and AIDS victims in Nigeria. What do you see as the most pressing issues related to the stigma and also discrimination in the country?
Thank you very much. I think the most important thing is for everyone to know their status and to show love and not discriminate, stigmatize people who live with HIV. Because if you do not know your HIV status, you cannot say you are discriminating or judging somebody that is living with the virus. So the most important thing is for everybody to know their status and know that when you are positive, there is medication to manage that condition, like every other chronic ill health, and to manage that condition such that you can live positively with it. We have testimonies of people who have been living with the virus for 20, 30 years and they are living well. But the first thing is you have to know your status and get on the life-saving, what we call antiretroviral therapy, to support you to live positively, to manage the virus in your body so that it does not, your HIV positive status does not lead to AIDS, because it's when you have AIDS that you can die of the disease.
All right, Doctor. Now, it's actually quite commendable that, we're seeing these influencers bring the campaign to life. But how effective has the role of social media influencers been in raising awareness about HIV and AIDS and also promoting a more inclusive and understanding society in Nigeria?
Yeah, we know the social media is very powerful these days. It's a tool that we can use to reach the population, the entire population globally, not just the older generation that we might reach in regular media. We know social media is where we have young people and we can get them to get information around about the virus and to know where to access services. And we have a number of them that have been working with us, and what we have been doing is to build their capacity such that they know the emerging issues, the status of management of HIV, and they can properly propagate that in the social media. We also use the regular media like the TV and radio, where we can also reach those who are on that platform. We are using all the platforms possible to reach Nigerians in particular, to know that for us to join the world to end the AIDS epidemic by the year 2030 as a global target. All acts must be on deck. Everybody must join the campaign. Everyone must know their HIV status, and when they are positive, they enlist in the care, and when they are negative, they stay negative by not engaging in risky behaviors through which they can contract the virus.
All right, now, so many other diseases have actually, come to the fore that has made a lot of people, forget or almost forget that there's such a disease as HIV/AIDS. Now, can you provide insights into the current state of HIV/AIDS prevention and treatment efforts in Nigeria, and what challenges, or barriers still exist in addressing the epidemic and also supporting affected individuals?
There was a survey in 2018 that gave us the figure we are currently working with, that we have about 1.9 million Nigerians living with the virus. Over 1 million of this population have been identified and enlisted into the life-saving care of the antiretroviral therapy. Amongst them, of course, there are more women living with the virus, because by the biology of the virus, more women contract it, not that women are the one inhabiting it, but more women contract it. But even as more women are contract it and they are care, we also have a huge number of men that are positive, but that do not adhere to their care, that do not adhere to their medication, who also will not share their HIV status with their partners. So one of the key issues that we have challenging is people not knowing their status and not sharing and not adhering to care. Another very important thing that is very critical in the management of the virus and in containing the epidemic in the country is stigma and discrimination, especially the stigma around those who know gender-based. We also have gender-based violence as part of the way they stigmatize, because most of the time it's the women who go to antenatal care, through which most get to know. And when they know, they share their status, people stigmatize them. You even find situations where they start, the family members, when they get to know, start saying they have brought bad luck and disease to the family.
All right, thank you
We have
so
a
much,
number of issues.
Dr. Falola,
Yeah.
for joining us at this time and speaking to us on HIV/AIDS. Thank you so much.